We want to take a second and check in. How's everyone doing? What's been your favorite takeaway and highlight of the day so far? Let us know on social media using the hashtag DataPoints. Next up, we have Faizan Javed, Senior Director of Search, Data Scientist, and Analytics at Kaiser Permanente, and he's here to discuss search and recommender systems for healthcare. Submit your questions in the Q&A panel, and we'll go over those at the end of the presentation. Over to you, Faizan.
Greetings, everyone. My name is Faizan Javed. I'm a Senior Director of Data Science and Search at Kaiser Permanente Digital. It's great to be here at the DataPoint Summit event. Today I'll be talking about search and recommender systems for healthcare. This is actually the first of a three-part series talk that I've been planning to give. So the goal will be to give you all an overview of how search and recommender systems can have an impact in digital healthcare. I want to start off by first giving some basic definitions in the areas of search and information retrieval. The core concept here is that it's a field where we actually focus on organizing and structuring and retrieving any source of information, right? So here you have the classic definition by Salton from back in '68. And the definition of search engines, it's basically an application of all the information retrieval techniques to large-scale test collections, right? So here we have the definition from Croft et al. From their recent book. So just to set the stage, so that we all know what are the basic foundations of information retrieval and search engines. So going from that, I just wanted to cover a few examples. So we all have experience with search, right? So on the left-hand side, you see web search. Right, so we either use Google or Bing or Yahoo or Baidu or Yandex from Russia or DuckDuckGo. These are web search engines. Basically, they give you the capability to actually search over the internet, right? So web search, large scale, over the entire internet. On the right-hand side, most of us also have experience with product search, right? So e-commerce is a big thing right now, and we all know during the COVID era, e-commerce, people were buying stuff online instead of going to stores. So product search, the focus is more narrow. It's all about e-commerce and retail. So we have some very well-known names here: Amazon.com, Zalando in Europe, Alibaba in China, as well as JD.com, and then of course Target, Etsy, Groupon. So most of us have search engine experience through these two avenues, right? Either through the larger scale over the internet via web search, via Google or Baidu or Bing, or on the e-commerce side via product search, where you go and your goal is to search and shop online, and you have sources like Amazon and Alibaba and Zalando. So that's the most common way that the general population interacts with search. But how about search for healthcare, right? So if we compare and contrast these two areas with search for healthcare. So we'll go dive into that next. But first, I want to set the stage, right? So why is this important? So first thing we have to understand is that the healthcare industry as a whole has not embraced a digital transformation as much as some of the other industries, right? So if you see some of the stats here, only 7% of healthcare companies have gone digital and an average of 15% across all the other industries, right? So that's one area of great opportunity. How do we enable digital transformation in healthcare? I also have a few other big numbers here, right, just to showcase the size of the healthcare industry. So, for example, the U.S. healthcare market spending will probably exceed $6 trillion by 2026, which is not that far away, actually. AI has been a big part of healthcare for a long time now. So the healthcare AI market is going to exceed $24 billion in the next few years. So the aim here is that AI has been in healthcare, right? So there have been a lot of applications focused on the physician and clinical side. But on the digital transformation space, the application of AI has a lot of potential. And the focus in healthcare is actually on cost savings, right? So we saw the example in e-commerce in the previous slide deck, where the goal is actually to increase revenue, make people buy more stuff. But the application of AI and machine learning and data science in healthcare for most of the use cases has the end goal of cost savings, right? Because healthcare is a big, massive industry, which can also be very expensive. We're also seeing a trend that there's a rise in on-demand healthcare, right? People are consumers and members, and people are actually going online far more frequently now to obtain their medical information needs. So and this has been accelerated by the recent COVID-19 situation as well, right? Where it became much harder to go into clinics or hospitals, and people had to adjust their information seeking needs by seeking out online digital healthcare channels, right? So hopefully that sets the stage and illustrates why this digital transformation powered by AI is important for healthcare. So going from that, so as we said, right, so the focus is on people going online to satisfy their information needs. But what are the main barriers to this currently in the digital healthcare industry? So there are actually three big factors. The first one is findability, right? How can we find the right sources to get that information from, right? And of course, if we focus on search, how can we phrase that information need and in collaboration with the right sources to get the information to satisfy our medical information needs? The second big barrier is comprehensibility. Okay, it's good. So if you're able to get the information, are you able to understand it? So healthcare is a bit more complex than shopping online or just browsing for sports or movies or things like that, right? How can we ensure that any information that's being provided is easy to understand, depending on the end user, and that we don't misinterpret it, right? So healthcare is a space where you can have some really severe ramifications if you provide the wrong information. And the third barrier that we need to overcome is context awareness. So providing and understanding information depends on certain health context, right? So it could be possible that like some healthcare information that's being provided to you may depend on the severeness of the medical condition, right? Whether if you are at an early stage or late stage of a disease, and also we have many other different parameters, right? Depending on what's your current age group and stuff like that. So context becomes very important, under which you provide the appropriate health information. So findability, comprehensibility, and context awareness are the biggest barriers to providing and accessing the right information for your medical information needs. So here's a snapshot of some medical search engines, right? So we have there are some of these are like really popular. WebMD has been there for a long time. We have PubMed from the U.S. government, and then you have Medline Plus, Mednar, and the TRIP database. So we do have some medical search engines that provide very different sorts of information. Some are there only to provide medical research papers. Some are there to provide general information. So there are a plethora of search engines that are currently serving the healthcare needs. Now, going from that, I wanted to discuss what are the two main personas or the use cases or the users or the type of users, right? So the first one are the non-experts, just regular folks like us, right? And these are like patients or members of any health insurance plan and so forth, right? The other big category are the experts. These are the domain experts, the physicians, the nurses, the practitioners. They already have deeper knowledge of several medical topics than the non-experts, right? So it's the distinction between non-experts and experts. And they, as we will see, they each have their own varying needs that needs to be satisfied via search and recommender systems in terms of seeking information. So just giving a short overview of the healthcare information retrieval space. One thing, this stat is very interesting, right? 80% of internet users have searched for medical information. We find that both experts and non-experts can use either a general web search engines like Google or Bing, or they can also use the specialized medical search engines to satisfy their information needs, right? And 5% of web search queries are actually health related. This is like if someone is searching on Google, like depending on like the overall population or the 5% of search engine of the search queries are actually health related. And what are some examples of types of queries, right? So people search for symptoms, right? Symptoms like a cough or a headache and so forth. They also search for what is the cause of a symptom, right? The cause could be like something like a bipolar disorder or diabetes or a tumor and so forth. And what are the remedies, right? People also want to know, okay, what can I use? What information do I have to actually fix this health issue that I may have? So they may want to know, is there a vaccine available? Do we have a cough syrup and so forth? So symptoms, cause, and remedy are the most common types of queries that are actually searched for in the healthcare space. So focusing on the non-experts, right? Non-experts, the top categories that they search for diseases, a treatment or procedure, health professionals, that's also a very, very popular category. Hospitals or medical facilities, and then you see health insurance, and then of course they have safety recalls, health hazards, and medical test results. So there are, as you can see, there are like multiple different categories that non-experts are interested in, and these are like what they look for when they're trying to satisfy their healthcare information needs, right? Focusing once again on expert versus non-expert search. When you're trying to build this experience, we need to understand their intent and what are their information seeking needs, right? So non-experts may more frequently use web search, which means that non-experts in most cases may not have information of those specific medical search engines. So they may gravitate more towards Bing or Google or Baidu, because that's the most common form of search that all of us have access to, right? So in contrast, experts who are domain experts, they may have more thorough knowledge of the domain-specific vertical medical search engines, right? So not everyone may know PubMed versus most of the people know Google or Bing. One interesting question that comes up here is that, we have defined experts as domain experts, but healthcare is a big and vast space, right? So someone who's an expert in like heart surgery or cardiology or let's say cancer may not be an expert in some of the other areas. So this is an active area of research that just because you are classified as an expert, you're not an expert in all the medical areas, right? So you might know more about cancer and let's say some of the other areas, but you may still be classified as a non-expert in some of the other areas. So how do we tackle that problem? So this is an open problem that's worth doing some research on in this space. The second area of a comparison between experts and non-experts is experts are actually more persistent when it comes to getting information, right? So what the research has shown is that they will actually reformulate their queries during any search session, right? So they are more persistent in trying to get the information that they need, right? And in terms of as we focus on the query stats for experts, right? The research has shown that they use more characters per query. They can create and construct more complex queries versus non-experts, right? And also for every session that they interact with the search engine, right, they actually are more likely to execute more queries per session and spend more time per session to satisfy the information need. Now, this could also be an interesting observation because experts might be looking for more complex information. So if the search engine is not giving them the information that they need, and if the information need is more complex, they're more likely to reformulate the query. They're more likely to rewrite the query and ask more questions to the search engine, right? So there is an aspect of more complex information needs for experts versus non-experts, right? So here are from the research. Here are some examples of top expert and non-expert queries. So if you see on the left-hand side, we have samples of some of the more high-frequency expert queries. You have examples like Bastrop disease, osteoporosis, limbus vertebra, double duct sign. On the right-hand side, you see the non-expert queries, right? Trustworthy health sites, WebMD, COVID, coronavirus, diabetes, pregnancy, hypertension. So one thing that's very obvious here is that the expert queries are more complex, right? They are diving deeper into some of the more expert or more complex medical disease terminologies. Like we won't expect a non-expert to use a terminology like double duct sign unless and until they are actually doing a lot of research in that space, right? So you see, just by glancing across these two lists, you can see the difference in the type of queries. In the non-expert space, you see that people use more common terms for medical diseases and symptoms, right? Like COVID, coronavirus, diabetes, and so forth. And they're also looking for information. So we see some queries like trustworthy health sites, WebMD, some of the more common stuff, right? They're looking for information that can further help them find that information. What are the trustworthy health sites and so forth? This illustrates that they may not be aware of all the domain-specific medical search engines. So just by looking at the small sample, like we all can see that there is a difference in the type of queries that experts and non-experts like issue to search engines. Right? So one thing, an interesting topic in this space is self-diagnosis search. And this is a type of search that people conduct before they go and consult a medical professional, right? So, I think this is a common behavior nowadays. If you are experiencing some symptoms or if you have some questions, you will instantly do a self-diagnosis. Even before calling a nurse or a doctor, you will go online and see, okay, hey, I'm seeing the symptom. Is something wrong with me? Okay, let's see what Google or WebMD or some search engine tells me, right? But the issue here is that, like, based on research, most medical search engines only have very low relevancy in terms of the results that they showcase to the users, right? So most of the times, on average, there are probably at best 3 relevant results in the top 10 search results, which is not great, right? So this can have some potentially serious ramifications, right? If you expose non-experts or people to medical information that can lead to incorrect self-diagnosis, right? That can be potentially harmful, right? So, this is very different if you're shopping online or looking for information on where to travel next. If someone gives you the wrong information, that's okay. I mean, it's not that big of a deal, right? But in healthcare, providing wrong information to a self-diagnosis can lead to some severe effects. So in this space, we do have an opportunity to actually leverage what the experts have been searching for, and what and how their needs have been satisfied, and provide and use that information to create a better experience for the non-experts. So there are some potential areas to combine the two sides and help the non-expert search experience. So another potentially active area of research. And finally, for search, I just wanted to mention this recent work by TripClick. I think it was just published recently at the ASEAN SIGIR conference. So this is actually the first large-scale database of log files of a web search engine, right? So tripdatabase.com, it's a medical search engine used for retrieving clinical documents and research evidence. So this is potentially a really great resource for improving information retrieval for healthcare, right? So the database has 5.2 million user interactions, up to and including the COVID phenomena from last year. This data set can be used for information retrieval and user behavior analysis research, and it can also serve as a healthcare information retrieval benchmark, right? It has documents, queries, and query document relevance. And this is, I think, a big deal for the search for healthcare space, because so far, as I had mentioned, this space has been lagging behind the web search and the e-commerce search space, right? So this is potentially a start of much more innovation in this space for healthcare. Next, I just wanted to move on to the next section, which is the other side of the equation, recommender systems for healthcare. When we talk about search, we talk about pulling information, right? You have an information need in your mind, you have a search engine, and you express that via a search query, right? Hopefully, you get the right results. On the RecSys side is what we call the push ecosystem, where the recommender system uses AI and machine learning techniques to, in a collaboration with information they have about the user and their previous interactions and their profile, to push content and information that can potentially be useful to the user. So it's this pull and push interaction between the two sides. For RecSys, we all have experience with recommender systems. The classic examples are Netflix recommendations, Amazon recommendations of products, and also YouTube recommendations. So I think most of us have this experience and an understanding of what recommender systems provides us. And once again, we'll see how things are different in the healthcare space, right? So just some basic definitions. Healthcare recommender systems, or RecSys, the goal is to use and leverage user profile information and their interactions with any items to provide relevant and serendipitous items to accomplish a certain task, right? So what do we mean by serendipity? Basically, the goal is like to recommend items or services which are not novel or unexplored that a user may not have searched for, right? So when you're searching for information, you will be given some information, but the goal of a Rex's system is to give you recommendations that you may not have thought about before, but it's still relevant to your needs. So that's actually a key property of Rex's. So when we focus on healthcare Rex's, right, what are the information needs and what data that we can use? So for healthcare Rex's, individualized healthcare information in an electronic health record, as well as user interactions in the ecosystem or on the website via search queries on web portals can be used to build a system to recommend items of interest to users, right? So the concept is still the same. Profile information for personalization and user interactions can be used to build a model. However, the key thing here in healthcare is that, once again, just like search, the quality of the item is extremely important. So this is not like e-commerce where you can recommend something which is not correct. And here, the quality of information that's being shared with the user is going to become very, very important, because once again, if we show or share the wrong information, it can have serious effects on the user, right? So trustworthy and verified content becomes very important in this space. So we've talked about healthcare access. Now, what are the things that we can recommend in healthcare? So we all know the examples of Netflix and Amazon, right? Movies, products, items to sell. And on YouTube, it's all about videos. How about healthcare? So here are some areas, things that we can recommend in healthcare access, right? Lifestyle change information, physical activities, and so forth, right? According to the user's needs. That can also be personalized using location and weather data. So if you're in Atlanta versus if you're in California, things can be very different, right? California is probably a big user base for yoga. Atlanta is probably a big user base for like jogging and things like that. Just some simple examples. We can also recommend nutritional information, right? Like if, diet is a big part of healthcare, right? We can recommend food items, diet items, and so forth to address serious things like weight loss, diabetes, and so forth. Of course, disease information, treatment, like condition management is a big space. Like if you've been diagnosed, what are the treatment plans that can be recommended? And these have to be verified by the physician, right? So this is one area where things have to be verified, because treatment plans can be very specific. Some other areas are healthcare professional recommendations. Doctor search is a big thing. So doctor recommendations based on your preferences, whether it's in terms of language or in terms of location or expertise. And we can also recommend facility-specific services, right? So for example, at Kaiser Permanente, we have a lot of services and products that can be recommended to our members based on their unique needs. So we have a lot of areas, a lot of things that can be recommended to both experts and non-experts. Finally, I just want to tackle some of the challenges in healthcare. So we have information like, for example, as I mentioned, user preferences and profile information is important, but sometimes these two things can be in conflict, right? So a user may say, hey, I prefer these kinds of foods or these kinds of activities, right? But the profile information based on the diagnosis might be in conflict, right? So someone who has been diagnosed with diabetes should not be recommended trans-fat food items, even though they may say, hey, I love eating a lot of steak. So how do we tackle that information, that conflict? The other challenge is persuasive recommendations. So the goal here is our goal in Rex's is to make sure that we give them information to improve their lives, right? Of course, now how do we measure that? How do we convince our users to take action on those recommendations? So there are some potential areas where you can combine authoritative information along with the recommendations to nudge people to take action, right? So that's another active area of research. And finally, trust and privacy. Once again, this is all about healthcare. In healthcare, trust and privacy are paramount, much more than in most of the industries. So trust explainability comes into play, right? Can people understand the recommendations, right? Can you explain why is the system making that recommendations, right? And privacy is the same thing. So patient preferences might be, we have some industry standards, some regulations that we have to ensure that we don't share all the information. One possible approach is to use data encryption, but that's usually a computationally expensive approach So there's a lot of active research going on where how do you trade off privacy and high performance, right? Because high performance means that if you're able to use all data, you might potentially come up with a better access system, but that's at the cost of privacy. So how do we balance that? So once again, trust, privacy, big areas of research in access for healthcare. So to conclude, I just want to just reiterate that there's an increasing demand for on-demand healthcare. So there's a lot of potential for online digital interactions in healthcare and how those interactions can help provide relevant information to both experts and non-experts, right? So there's a lot of opportunity to reduce cost in the healthcare space via digital channels, but we have some barriers to information accessibility, right? As I mentioned all the way back at the start of the presentation, findability, comprehensibility, and context awareness are big areas to overcome. And search and recommender systems have the potential to play a big role in driving this innovation for the online digital healthcare experience, right? So this is one area which has a lot of potential in the healthcare space, and I think we have a lot of catching up to do when compared to other industries. And here are some references, and I think that wraps up my presentation, and thank you all, and I'll take questions now.
Great, thank you so much. That was a wonderful presentation. We do have some questions from the audience, so I'll go ahead and jump right in. The first one is, how can you tell if someone is an expert or non-expert based on their search history?
So so for this one, there are two aspects that we can look at. Basically, the first one, as I just discussed in the presentation, is what's the source of their information-seeking search engine, right? Whether are they coming in from a general-purpose search engine like Google, or are they using a specific medical search engine? And the second are query stats, right? So basically, the kinds of queries that they are actually running, right? So usually we see that experts run some more sophisticated queries, and they also have certain patterns where they try to reformulate the queries multiple times. So generally speaking, we can look at these two patterns to decide whether it's non-expert or expert. But of course, there's still some more research to be done to make sure that we are more specific in this area.
Wonderful. So the next question we've got is, machine learning metrics for search are well established, but what are the business metrics for search in healthcare?
Yeah, so I think this is also very important because most of the times the success of a project is gauged by business metrics, not the machine learning metrics. So in healthcare, the focus is most of the times on reducing cost. So if you compare it to other industries like e-commerce, like Amazon or Walmart or these other areas, there the goal is to increase revenue, right? So the business metrics are usually things like gross demand and revenue, while in healthcare, we tend to focus more on cost reduction. So there are some specific cost reduction metrics like reduced rate of interactions and things like that. So it's going to be a cost reduction versus revenue equation in the business metrics space for healthcare.
Great, and we've got time for just one more quick follow-up on that. How do they compare to those in other industries, such as e-commerce?
Yes, so like as I mentioned in the previous answer, in e-commerce, like if you go to Amazon.com, the goal for Amazon search is always to make you buy more stuff. So they focus on business metrics like gross demand and revenue. In healthcare, we are actually sharing information, not selling products. So search and recommender systems in healthcare focus mostly on cost reduction at the business metric level perspective.
Wonderful. Well, thank you guys so much. We appreciate your wonderful presentation. Just a reminder to everybody that these sessions will be available on demand approximately 2 hours after the live portion ends. And you can use the same link from the virtual lobby to access them. With that, I'll say thank you very much. We're going to take a quick break and then join us back here shortly with Colin Chen, Executive Director of JP Morgan Chase, who's going to talk about data science in the next generation of risk management. Thanks again, stay on, and we'll have a great day.
Thank you.